Good morning still, almost afternoon. I hope you're feeling as inspired as I feel and as calm. And I'm so pleased that I now have a good excuse to drink coffee. And so I hope you're feeling relaxed, but I hope this next talk will inspire you. My name is Meera Rastogi. I'm a licensed psychologist and a board certified registered art therapist. And I'm here to talk to you about art therapy and Parkinson's. And so a little overview of the talk. I'm first going to introduce some artists that have Parkinson's. I kept one image in by an artist who does not have Parkinson's, and I'll explain a little bit why I included that one, but all the other artwork is done by people with Parkinson's. Then I'm going to explain what art therapy is, how art therapy works. We'll cover a little bit of research on art therapy, and we'll talk about caregivers and care providers, and is art therapy for me or you? And so here's the first image, and I think images really tell a story, and particularly in art therapy, images tell a story of where somebody's been, where they currently are, and where they're going. And this image I kept in, even though I debated with myself, should I keep this in? Because this was done by an artist, Anita Kuntz, for somebody with Parkinson's, Jennifer Parkinson, as a tribute about her life story. And the title of it is called Live Well, Do Well. And Anita was inspired by Jennifer Parkinson's struggle with early onset Parkinson's. She was diagnosed when she was 32 years old. And Jennifer started a boxing program for people with Parkinson's. And Anita was really inspired by how resilient Jennifer was despite her early diagnosis, and even during those moments where her limbs feel rooted to the ground and she's frozen from her symptoms, she still is fighting literally and symbolically against Parkinson's disease. And the next person I'd like to introduce you to is Margaret Ray, who's another artist who has Parkinson's. And this image she created to show that she still goes dancing. She enjoyed it before she got Parkinson's, and she is going to enjoy it until she no longer can. She talks about how this image shows the togetherness of doing a dance together, dancing through and joining. It's collaborative, and this image so powerfully shows that strong bond and that will to enjoy things as long as she can. The next image is a little disturbing, but this is by a painter who was diagnosed with Parkinson's, and he was tracking his good and bad days. And why I picked this image, even though it's a little disturbing, is if you overlook the skull part, he was doing a still life, which that means trying to accurately portray an image as you see it. And he started tracking his symptoms. On his good day, he could see colors clearly. He had control over his movements. So on your left, you see his good days. And then he also did a same still life of the skeleton. It was a skeleton model in his studio. And on his bad days, he has trouble differentiating colors, trouble controlling his movements. And why I chose to include this image in these slides is to show how much these images speak volumes about the ups and downs of his symptoms. And loved ones who don't have Parkinson's may have difficulty understanding the power that symptoms have over people, but these images and comparing this artwork clearly communicates his struggle, and with things that come so easily to him are even so difficult. And that is really hard to capture that difficulty in words. And when you see the images, you can really see how difficult living with this disease is on some days. This artist really struck a chord with me. His name is Wendell Lowe. And he was a practicing artist and an art teacher before he was diagnosed with Parkinson's. And when he was diagnosed, his movements got so severe that he decided he was going to create artwork using finger paints. And all of this artwork is created by him. He has a tool that he uses in the finger paints, and he uses his fingers to carve out images. And his goal with his work is to show and help people really feel the symptoms of Parkinson's. And so you can see some of these images with the eyes, how he's affected with his visual perception, how some of his limbs feel stuck, and maybe how he feels about his body and sometimes feeling overwhelmed. But his real goal is helping to communicate what those symptoms really feel like. And I think he does an excellent job. So art therapy is not becoming an artist. Even though I've shown you those pictures, I really wanted to show you how powerful art can tell a story. Art therapy is not about creating beautiful images, being a highly skilled artist. You can do art therapy even if you feel like you draw like a first grader, which I hear every day I do this work. And so art therapy is not about becoming a great artist. So you might be asking, well, what the heck is art therapy then? And so what art therapy does, and I have this table because I think it clearly shows, an artist has clear knowledge of art materials and understanding of aesthetics, and a counselor has counseling skills, group therapy skills, and an art therapist is combining those. They have knowledge of how the materials work, how they impact people emotionally, what materials might be useful depending on the symptoms you're experiencing, and then how can we use the art image to help create healing, to help give you a voice, to help you find the words that you may find very difficult to articulate what you're going through. And so you might be wondering, well, all of this is nice, an art class would be lovely, but how does art therapy actually work? And so when you're diagnosed with a medical illness, I'm probably talking to many of you who could say much more about this. It causes a sense of disorganization internally. You never imagined that this would happen to you. This was not part of your life dream or your goals. And so becoming very disoriented, feeling out of control, realizing that you're going to have a loss of independence can really take a toll on your identity, your self-esteem, your confidence, and it can also create a lot of isolation. And so art therapy gets you physically active. It requires physical movement. You begin to express your feelings through your artwork, and research has shown this helps increase your ability to find the words to explain what's happening to you. It can also, over time, create a sense of self-confidence, or what psychologists call self-efficacy. It helps you build confidence and a sense of mastery, and it also stimulates those brain cells by trying new things. It also helps you learn how to deal with feelings you might have been trying to avoid in a way that's non-threatening. So in art therapy, I'll ask you to draw something and you think, okay, I'll draw this. And then as we talk about it, you open up in ways that feel more comfortable and safe to explain what's going on with you. It can also cause increased connectedness, particularly if you do art therapy in a group. And this can provide a great sense of connectedness, decreasing isolation, and can provide new meaning and purpose. Art therapy can help work through some of the disorganization to help you develop a new identity separate from your illness, and it can also help provide personal insight. And then some really nerdy facts. When you do artwork, similar to meditation, similar to yoga, it activates this part of your brain that helps you turn inward, that helps you go into a meditative state. Some people say it's a flow state. And then by doing the therapy, it helps you reason and think about things in new ways. So it's operating on different brain networks. So how does, oh, did I go backwards? Oh, so I wanted to demo how art therapy works, since it's a little hard to have you, you may not have art supplies at home. You might be wondering, well, how does this work? Okay, I get that Dr. Rastogi will have me paint this picture, but then how do we do the therapy piece? So I picked a couple examples to walk you through how we would do this. So Margaret Ray is not a client of mine. She's not a client of art therapy that I know of. But if she painted this in an art therapy group I was in, we might look at these hands and explore them deeper. One way I might explore these hands deeper would be to ask her to give each hand a voice. So when you see the hand in the front, the hand seems kind of comforted by the other hand. So the hand might say, you feel warm, I enjoy your comfort, I like how you're guiding me and helping me as we dance together. And then if we were going to give a voice to the hand that's holding the other hand, that she might say, that hand wants to hold you steady, wants to provide you support. And so Margaret may not be able to find those words that she's trying to express through this image, but by an art therapist facilitating that process to go deeper, she may find new words to express what is going on with her. This is a painting, not from an art therapy session that I did, but from an article I found about art therapy for people with Parkinson's. And Rita painted this image of her standing out of her window with her Parkinson's medicines to the right. This would be a fairly typical art therapy image. And so if I were having Rita in a group and we got this image, how might we discuss this? You know, I'm really struck by Rita facing the window, and the outside beautiful world is going on beside her, and she's stuck behind this window. To me, it has a sense of isolation. So I would ask Rita, are you feeling isolated and separated from the world around you? What is a way that we can add to this image, that we can look at this image differently and help you get into the world with the flowers blooming? We might explore deeper this relationship with her medications. It's pretty interesting. Rita chose to put her medications in here. How is she feeling about those? Those are on the inside with her as compared to the outside of the world around her. So we would talk about what she might be experiencing. I don't know if she is, but that as the therapist, that's the kind of conversation we'd have to go deeper and understand things deeper. So you might be asking, does art therapy actually work? And so art therapy can address both motor symptoms and non-movement symptoms. Traditionally, art therapy has focused on the non-movement symptoms, such as improving mood and quality of life. But newer studies that are coming out, and they're small studies, have looked at some of the motor symptoms. And so I'll review some of those studies. So art therapy does have several studies that have shown improvements in mental health, and that's been long focused on studies on art therapy, that it does improve mood, decreases anxiety, improves quality of life, and it helps people to express what they're feeling. What is more interesting, more recent studies, one isolated, found that art therapy tend to help people feel less sleepy and more wakeful. And so we all know some people have difficulty sleeping with Parkinson's. And so if this helps you get more alert, great. Research has also found that art therapy can help with motor function and reducing tremors. And so studies have been done working with clay and working with drawings that helps to improve motor function. And a more recent study that is really fascinating, but again, it's one small study, has found that art therapy did improve the visual network in the brain and the visual cognitive skills. So there are some promising results that with more studies might show that art therapy does indeed target not motor and non-motor symptoms of Parkinson's. And then I wanted to include caregivers and care providers because they're often overlooked and they experience an enormous amount of stress. Many caregivers and care providers have a lot of physical demands, unexpected changes, grief and loss, especially if you're a caregiver, dealing with the financial implications of the illness, and they too often lack support and isolation. Care providers can and caregivers can feel a sense of resentment. All of this can lead to poor care, mistakes, impatience, and irritation. So I'd also encourage care providers and caregivers to do some self-care, and art therapy is a great way to do this. And many hospitals have art therapy programs for caregivers and care providers. And I'd suggest separating the group. My experience has been when you have everybody in the same room, the care provider wants to care for the person who's the artist doing the artwork, and really we want to empower that person to do the art on their own, to have a sense of independence, and we want to empower the caregiver to do something for themselves. And so art therapy is a great way to do that, to get some refueling in your tank so that you can attend to the things you need to attend to and not result in burnout. So you might be thinking, is art therapy for me? And I would say, are you open to working with art materials? You don't have to think you're good. You don't even have to have any experience, but would you just like to try it out? Do you want some emotional support and relaxation? Then I would encourage you to join a group. We offer a free group at the Neuroscience Institute. We're running it virtually and in person on Mondays 1 to 3. And if you are not local, you might want to schedule an appointment with an art therapist. You can do a Google search for Art Therapist Locator, or go to the Art Therapy Credentials Board and find a credentialed art therapist. And then I'm going to leave you with a really inspiring story of Norman Greenstein, who has labeled himself the Parkinson's painter, who came to become an artist. I'm pretty sure he's going to say in his 70s. And he's just going to talk about the role of art in his life and how he manages his symptoms.
Just off Main Street in Manchester, there are the reds, there are the blues, vibrant colors on canvas. And then there's that gray area. It's the one that Norman Greenstein has been fighting off for 14 years.
My family and I went on vacation to the White Mountains in New Hampshire. And I was driving down and I noticed my leg was shaking. I was diagnosed in 2008 and I started painting probably around 2013.
Norm's diagnosis, Parkinson's disease. The debilitating effects are robbing him of his mobility, but not his motivation. With a palette and some perseverance, a new enterprise.
Well, I had always wanted to try my hand at it.
And a new image.
Right now, it's a face.
The 78-year-old father and grandfather has become the self-proclaimed
The Parkinson's painter.
the Parkinson's painter. His hand wavers, but his determination is steady. It is part high gloss and part Bob Ross. 7 years ago, Norm decided to go outside the lines by painting within them.
Having art as a hobby or as a profession, it relaxes me to paint. My hand might shake, but I don't paint with my hand. My hand is like an instrument. It's like a brush. I paint with my mind.
In his new life, the former nonprofit foundation exec has created more than 100 paintings. There's now a book. There's a website. And at the Workspace Gallery in Manchester, Norm's art adorns the walls. Norm, it just flies in the face of conventional wisdom that somebody with your affliction can paint like this.
Well, when my hand shakes too much, I learned a trick. I take my right hand when I'm right-handed, and I put the brush in my left hand. Or sometimes I'll use two hands.
Norm will tell you he's still a starving artist, but some paintings carry price tags upwards of $20,000 a piece. 20% of the profits go to Parkinson's charities, like the Michael J. Fox Foundation.
It's become a whole family project. We have a developer team helping us release his first NFT collection to market, so it's really exciting how many people in the community are inspired by my dad and all the people he's brought together.
It makes you think, it makes you feel, and that's what it's about. So we love the fact that people are inspired to create, and we love bringing those people together.
A few more dabs, some added swirls. There are the reds, there are the blues. And for Norm, the Parkinson's painter, he insists on keeping his days colorful. It's a simple message, right?
Yeah, it's a simple message. Don't give up. Do what you can and do more. Even a guy with Parkinson's, especially a guy with Parkinson's.
In Manchester, Jim Altman, Fox 61 News. And as we said, Norman has his own Parkinson's Painter website where you can see more of his works. We'll have a link at fox61.com and on our Fox 61 News app. And some of Norm's artworks are on display at the Workspace in Manchester, guys.
Jimmy, thank you so much. I mean, talk about being able to adapt and also being incredibly talented.
And what I found amazing about it, Jimmy, was the fact that he didn't paint prior to his diagnosis. He started 5 years afterward, right?
He had always wanted to be a painter, Ben and Jen, and he took it up after his diagnosis and said, I'm not giving up on this. I'm going to become a painter.
Incredible.
Here we are.
Incredible.
We also want to shout out Norm and his wife Phyllis on Thursday, right? Thanksgiving. They're celebrating 50 years of marriage. Happy anniversary.
And then here's my email. If you have any questions or comments, that's available to you. Are there any questions?
So when you mentioned materials to promote healing, do you base that on getting to know a person, or are there different baseline materials that you use?
That's a great question. And so it's a combination of both. There are always individual differences and things people like, but there is a theory in art therapy called the expressive therapies continuum that talks about how different materials do tend to elicit certain emotional responses. For example, colored pencils help people feel more in control versus paint tends to make people feel more emotionally open. Does not always have that effect on people, but so it's a combination of meeting people where they are and their individual characteristics and what we know about the materials.
Have you ever heard about using an art journal for healing?
Oh, absolutely. Art journals for healing can be used in all different kinds of ways. There are many people who have done their journey from diagnosis to treatments and keeping records, or you can just use it as a way to just enjoy yourself and document your daily life, your cup of coffee, and be present in the moment. So there's lots of ways to do daily journals.
So is art therapy mostly painting or drawing, or do you do any other activities or projects?
We could do all kinds of projects. So people use all different materials, from clay, collage, painting. You could use found objects of things in your house that you wouldn't even think of. You could make an art piece out. We've done that. So
That's it.
okay, and I think we're close to being out of time.